Welcome to the Plan B channel, where we provide accurate, updated and unbiased information about HIV treatment, whether you're newly diagnosed or you've been living with HIV for some time. I'm Ben Plumley, a global AIDS advocate and strategist, and I'm passionately committed to helping people get the right information so that they can live long, healthy lives. In this episode, we are going to be covering dual combination therapy. And we're joined by Dr. Royce Lin, an HIV specialist from the United States of America. He's also Associate Clinical Professor at the University of California in San Francisco. Welcome, Dr. Lin.
Thank you very much, Ben. Happy to be here.
So many of our patients are asking about the new research that's coming out about dual combination therapies. Does it make sense for them to start on dual combination therapies, or if they've been on triple therapy, should they talk to their doctor about moving to just two drugs? How do you counsel patients?
Yes. So I think, Ben, the way I think about the two-drug therapy combination is that traditionally, for the last 20 plus years, one of the key cornerstones of HIV treatment principle is that you need three active drugs for there to be activity against the virus. Some of the newer medications, such as dolutegravir, which are very potent, does appear to be strong enough to suppress the HIV virus, such as in a combination of dolutegravir plus 3TC. I think, though, that it's the way I think about the two drugs is that it's potent enough, but definitely not as potent as the three-drug combination. This is the reason why one group of people for whom dual drug therapy is absolutely not appropriate are people who have a high baseline viral load. So if you are someone who has an initial HIV viral load of over 500,000, a two-drug combination is not going to be strong enough to be able to control the virus. And that's because two drugs are not as strong as three drugs. I think the other caveat to remember is that the research on the dual drug therapies were conducted in pretty ideal environments in patients who could guarantee 100% medication adherence and who also had access to frequent viral load monitoring. And that oftentimes is not a reality for many people for whom adherence may be a challenge based on factors in their life. One last consideration is that if you are someone who is living with both HIV and hepatitis B, dual drug therapy is also not appropriate, because in people who are co-infected with both HIV and hepatitis B, we want to make sure that you are on a treatment that treats both HIV and hepatitis B. And in these patients, the two-drug therapy is insufficient and not an appropriate option.
So lots of questions that a patient should discuss with their doctor, and a lot of questions that need to be thought about before even considering moving to a two-drug regimen. Dr. Lin, thank you very much. Well, that's the end of this episode. In a moment, information and links about treatment, HIV treatment in your country will come up on the screen, as well as how to contact us at Plan B if you've got any questions or suggestions for topics we should cover on the episodes. Thanks for watching.